past, I've done LPN, so this time around, I'm doing the RN NCLEX review. So this is the Saunders. This is what I usually use with my students. So you get a taste of what we go through when we are covering information to either understand material better for classes or to prepare for the NCLEX. This is also for students who may be interested in nursing but are not sure if nursing is for them. So it kind of gives them an overview or an in-depth view of nursing and what it's all about, to see if they are up to it, up to the challenge, if it's interesting enough or something they're really capable of doing. Okay, so we're going to start with reproductive system, maternity nursing. So the first point I wanted to make here is, in nursing, you have to know your anatomy, right? That's why one of the prerequisites that you cover is anatomy and physiology, so that you can understand your body and how it works, right? Because it's important to know how the body works so that when things go wrong, that's why you go to the hospital, that's why you need a nurse, then you're able to know much better how to fix it, because you know what is broken, because you would have understood how it should have been working, right? So as we're covering reproductive system, we're going to go over the reproductive organs and the norms, right? What they're there for and what they are. So the first thing with the in the things that I cover is what mostly is teachers and NCLEX test about, right? So there's a lot of information here, and I always tell students it's good to read it all, but if you're talking about, you know, what to focus on, I usually let you know, and I highlight whatever they are, right? So the first thing is in the female reproductive structures, we have the ovaries. So it is important to know that this is where the ova, which is the eggs that we excrete or expel every month, that's where it's coming from. Right, you have two ovaries, two sides, left and right, secretion of estrogen and progesterone, but mostly knowing that that is where the egg is. Also knowing that you have as many eggs as you will ever have in your lifetime, but they do not all mature all at once. Each one is matured at a specific time when you're about to ovulate, right? You also have your fallopian tube. That is the passageway from the ovaries that the egg travels to get to the uterus. Also now that the tubes that propel the ova from the ovaries to the uterus, right? This is also the place of fertilization, right? So when an egg meets, or when a sperm meets an egg, it happens in the fallopian tube. It fertilizes in the fallopian tube, and it starts multiplying in the fallopian tube, become a zygote in the fallopian tube, then travels down and gets implanted into the uterus, right? These are things that you should know. And it's important to know that because there's such things that we will see later on that are called ectopic pregnancies, and it happens outside of the uterus, because ectopic, that's what it means. So it's good to know that the egg was coming from somewhere to be implanted in the uterus. So when it's not implanted in the uterus, and then it gets fertilized and it starts growing and the baby starts being produced, it outside of the uterus, that's a whole other problem, right? And that happens in the fallopian tube. But it can also happen because in between the ovary and the fallopian tube is like a little junction, a little gap. God forbid if that egg slips out and falls somewhere in the endometrium or somewhere there, the baby can be growing there too. Or, well, it's not really a baby because it never develops into one, right? But ectopic pregnancies, that's just knowing your anatomy and where things are will help you understand the problems that might arise, one of which being ectopic pregnancies. Also, going back, we have the uterus, right, which is the muscular pear-shaped cavity in which the fetus develops, cavity from which menstruation occurs. So this is where the fetus develops, right? So that is where the placenta will be produced, will grow. That is where the baby is being fed. That is where it will mature. And just so that you know, it says it's a pear shape, right? And it's kind of like an upside down pear because the os, which we'll see, the vagina, the cervix, all of that is in the bottom, and the top is the bigger portion. That's where you want your fetus to be implanted, or your ova or your egg to be implanted, because you need it to have space so the placenta can, let's say the egg is like a little bit of bitty thing right here, and the placenta will take the whole space and the egg will thrive from it. The placenta needs place, a placement that is not too close to the Oz where it's going to dilate and open up, because that can cause another problem, right? So it's important to know you want the egg to attach itself to the uterus on the upper side. There are problems that occur when it happens in the lower side, right? And it's the cavity of menstruation. So if a person does not get impregnated, we need to know that the lining of the uterus, it becomes engorged, and it becomes ready, full of blood for the baby to be fed eventually, right, when the fetus does develop. But if that doesn't happen, it has to shed all of that lining, and that's what menstruation is, right? That's the cavity from which menstruation occurs. We have the cervix. The most important thing to know is that the external cervical odds open into the vagina, right? And it's interesting to know that, so your vagina is different from, so the hole that the baby comes out of is different from the hole you pee out of, right? Your urethra also extends into your vagina. So you have two holes there, that when you're catheterizing, you need to know when you're putting the catheter in, you're putting it into the hole, the urethra, where the pee comes out, but where the baby comes out is a different place. I'll never forget when I first realized that I have two holes. What? I remember I don't know if anyone who's watching is of a Caribbean descent, and I would go to the bathroom and I would pee really loud, and my stepmom would be like, "Why do you pee so loud?" And I'm like, "What?" And she's like, "You need to pee quieter." And I remember telling one of my teachers that, and she's like, "What does that have to do with anything? Like, you're peeing very loud," because in her mind that meant like, anyway, two different holes. It's just two different holes, okay? But not everyone knows that. I also heard there are Jewish young ladies who are not familiar with their anatomy until the day that they're getting married, and they have to have a woman to come and teach them about their anatomy. So not everyone knows that you have a cervix that leads to the Oz that opens in the vagina, and then you have urethra that also opens into the vagina. So that's important for you to know. Okay, also now as we speak about the vagina, that is known as your birth canal, right? That is where the baby comes out of. Also the passage for bleeding, right? Menstrual blood flow, and also for intercourse, and also for the fetus. So again, two different places. Now we go to the male reproductive structure. We have the penis, right? So when we look at the male reproductive system, we know that the structure include the body or the shaft, the gland, and the urethra. So one of the things that we need to remember when we think about the male anatomy, so as it relates to reproductive system that's connected to nursing issues, is that the male's urethra is different from the woman's urethra because it is longer, right? You have your vagina, which is attached to your, like when you look at the anatomy, the male's is longer, right? So that also indicates that a male will not have UTIs as often as females. As a matter of fact, when a male has a UTI, it's usually because of an STD, because the urethra is so long that when there's bacteria there, it has so much of a way to travel that it doesn't make it, right? But if if they have a UTI, then they will have issues there. So that's one of the things that, I wanted to make mention when we think about the male's urethra, right? But they also get catheterized the same way as the females get catheterized if they are having issues with expelling their urine, right? So that's one of the things that you have to remember as you cover the anatomy that's connected to some dysfunction that might happen where it relates to the male or reproductive organ. Now, moving on, another point to be made is when we talk about the normal temperature that is slightly cooler than the body temperature. So back in the day when we saw how men dress compared to now, right, we noticed that, men used to wear really tight clothing, really tight pants, so to speak, and they're kind of moving back into that a little bit, I noticed. But that was one of the things that, that had to be changed a bit when it comes to the organs, because the male's scrotum has to be cooler. And if it's not, then it can cause issues with the sperm, right? Because that's where the sperm is located. So usually we'll tell them, especially if they're having, sterility issues, like wash the clothing that they'll wear, that kind of thing, right? But just being aware that that can be an exam question, knowing that the normal temperature is cooler than the body temperature. Also, when it comes to the a scrotum. Another aspect, when we get to pediatrics and we talk about how the scrotum is supposed to descend, right? That can be also an issue. If it descends late in life, that can cause a problem for later on as an adult, once they hit 20, 21, and they have issues there because the scrotum dropped later on. Maybe I'm not sure around what age it drops, but it's supposed to do it at a certain time, right? I forget the age range. Then the next point to remember is the prostate gland, right? Knowing that only males have prostates, right? This is a issue for males because the way they're tested is really uncomfortable, right? This is the prostate, you can feel it only through the anus. So when they go to get examinations, they have to bend forward, spread their cheeks. The doctor puts a finger in there and then he looks for the prostate, and that's a super uncomfortable feeling for guys, and that's why they don't do it. And that's one of the reasons why a lot of men develop prostate, hypertrophy, which the prostate becomes super huge, or prostate cancer, which can develop into prostate cancer. But it's preventable if they get screened early, right? But then they don't want to because it's uncomfortable. Also, the thing to remember too, when we'll see this later on, when a man does have their prostate that's enlarged, it causes them to have difficulty in urination. They can also have like bleeding, right? So that's also something that you need to remember when we cover prostate in men. And we're going to see, the different surgeries that they have to undergo, the different precautions you must take with each surgical procedures and things like that. But we will get to that at a later time. Now, moving on, when we talk about the menstrual cycle, we talk about the ovarian hormones. One of the things to remember here is the menstrual cycle, the regular reoccurring physiological change in the endometrium that circulates in its accumulates in its shedding may vary in length, with the average length being 28 days. So the average length, it's important to know that it's an average length. Not all women go through 28, but most women do, right? And so usually they'll ask you to have a calendar. It's very important, especially for obstetrics, when we talk about menstruation, because when we're trying to figure out when the baby is due, they will ask you to do what's called the Nagal's rule, which we'll cover later. And that's how they calculate from the last time of your menstrual period, and they add 3 months, and they subtract 3 months, and they add a year. So it's a whole calculation that they do, but in order to do it accurately, the woman has to know when the first day of her last menstrual period is. And that's why it's good to tell young girls, to make sure that they take a note of that, especially once they become active, right? And that way, if they do become pregnant, they can calculate when the baby is due. Another thing to note as well is the timing, right? For young people, when we do pediatrics, we'll learn, right, puberty, what time it starts. It's different for everyone, the different days and ages, right? But this is an important aspect to know. Your menstruation will usually start, a child's menstruation will usually start 2 years after their breast buds, right? And that's in pediatrics. But as you know, when I cover any kind of information, I try to do a bit of repetition and pull out information from different branches of nursing that also involve the topic that we're covering, because the important thing is that you kind of cluster information together to help you remember them. And when they're questioning you on the exam, they like to ask the questions that cover multiple topics, because then they've questioned you on that and they covered 5 things and you've gotten that answer and you're good, right? So those are the ones that I always encourage people to really understand and learn, right? So that is some information there on menstrual cycle. Again, everyone is a bit different. They should know their date. Everyone have a different feel, like some people have pain, some people don't. The shedding, some people bleed a lot, some people don't. So if it's heavy bleeding, there's usually a reason. Estrogen issues, whatever, your doctor will tell you. It's good to get that evaluated. Also, there can be pills or shots that women take that might reduce the bleeding, reduce the actual menstruation, or eliminate it altogether. And that is something that they often ask questions about as well, which we will cover later on. So now let us move on. So now we're talking about the pelvis here. There are different types of pelvises and different measurements. The measurements are not truly like covered as much as the type. And I only want to cover the two that are most, I wouldn't say important, but the ones that are covered the most. There are, I believe, 5 of them, 1, 2, 3, 4. Sorry, there's 4 of them, but the ones that we'll see the most on exams are the gynocoid. This is the normal female pelvis. This is the optimal. This is the one that we want to have because of the way the shape of the pelvis is constructed. It allows the baby to go through much more easily, and the woman is not in labor for too long. She's not in pain for too long, and there's no risk for the baby's health, or God forbid, there's no death, right? Because the problem with the pelvis, for example, the latter one, the platypoid. Now, this platypoid is the shape of a man, right? And as you've seen, right, men are usually wider up here and smaller down here. Whereas women, they say when you reach puberty, what happens is your hips widen, right? So your hips widen so that it can make passage for your baby when the time comes, right? And that's a great thing when your hips widen. So men's hips do not widen because they have no part in labor, but you do have females that you have seen that have smaller bottoms, and they have the most difficulty in labor, right? So here we have the android pelvis. Theirs is a slow descent, mid pelvic arrest, and then we have the platyploid, which is making labor and vaginal birth difficult. And sometimes they'll have C-sections, these patients here. And so another thing to remember, and again, we'll see it later, and that is when it concerns the pelvis, there are levels, right? As the baby is descending, you have 0. That's when the head of the baby reaches the islet. And then you have -1, -2, -. For more information on how to register for classes and get help from our tutoring center, visit www.gab-nictutor.com. That is www.gabnicnursingtutor.com. To view our free or paid classes, sign up on www.thinkific.com. That's www.thinkific.com, and register for the pre-recorded classes of your choice after searching for the Gab-Nic Tutoring Center uploads. We offer in-person tutoring and Zoom calls. You can also find us on YouTube for more free classes and tips on how to do better in nursing. We are also on Facebook, where we upload articles, tips, and tricks on how you can make your journey to becoming a nurse smooth and near effortless. Did I mention Instagram? Basically, we are everywhere. So check us out or call 917-602-9927 and we will tell you just how to join. See you soon.